Massachusetts has become one of the leading states in the country in getting people vaccinated for COVID-19. Much of the work here was done by CIC Health in collaboration with public agencies and community partners, whether at mass vaccination sites or pop-up clinics. To tell us about the effort, why it matters, and what happens next are two guests from CIC Health in charge of vaccine equity and access, Samantha Joseph, and Director of PR and Communications, Sue Minichiello. Thank you both very much for being with us.
Thanks for having us.
I want to start with Samantha, because in Massachusetts, we're almost blasé about medical advances and some impressive figures. But when it comes to getting people vaccinated, it takes more than just that kind of expertise. What did it really involve here?
Yeah, absolutely. As important as all the medical infrastructure was, we also needed a really robust set of community partners in order to make sure that everybody had access to the vaccine. So, our site at the Reggie Lewis Center in Roxbury, from the very beginning, was very inclusive of all the, community organizations and all the experts, who could really help guide the process.
Well, your background is engagement. So what did engagement mean here?
Yeah, absolutely. We started with them from the beginning. So, one of the most important things was identifying which languages are appropriate for the community and being very sensitive about making sure that we had materials available in those languages. We had translators on site at the Reggie Lewis every day to speak to people in their own language. We had door knockers in the community, all kinds of things to really make sure that our effort was outside of the walls, not just inside of it.
So what about the results here? What kind of numbers did we end up with from the Reggie Lewis Center, at least?
Yeah.
Well, at the Reggie Lewis Center, in total, we had over 136,000 vaccines administered there, and 56% of those were shots that went into the arms of non-white residents. And I can do further breakdown of that if you would like. But we were from the beginning, we sort of had set a bar that we wanted to end up at least half, if not more, of the folks collectively coming to that site being people of color and folks in other underserved areas and hard-hit areas surrounding the center. And we hit that mark and a little bit more. So we felt pretty happy about that.
Samantha, the initial numbers were kind of frustrating. And people wanted to see more diversity there. So what did you do to make things work better after that?
Sure. Yeah. At the beginning, there was so much demand for the vaccine. I think it was challenging for every group to have equal access, and that's why, first of all, the location itself was so important, selecting Reggie Lewis, which is really a beacon and a staple of that community, a place where people feel safe, where they're familiar, was so important. And every vendor, that we had there reflected the community so that when people walked in the doors, it felt, like a place that they knew. We had, doctors and vaccinators, from the community as well. So I think just creating that space, where people felt safe was really important.
And you had partner groups, Roxbury Community College, the Black Boston COVID-19 Coalition. What was it like working with them?
Yeah, absolutely. We could not have done it without our partners. The Black Boston COVID Coalition really ran the majority of our outreach and had something like 150 people in the community on a daily basis talking to their own neighbors, their own friends and family, as well as others. We worked with at least 24 community partners across, throughout the entire time we were there, touching all different kinds of groups.
So what about logistics? Because I think that's the part a lot of people might take for granted. I went to another vaccination site, a mass site, and a lot of people, I keep hearing this over and over, they were impressed with how smooth everything went. But how did you get it to work that well?
Well, I think, CIC Health emerged as really a logistics company. We sort of emerged during the pandemic as a place that could provide testing solutions initially. And we are not a healthcare provider. We are more of, again, a logistics company. And so we are good at sort of figuring out who is out there who can fill the different roles that need to be filled and bring everything together. We've had some amazing partners in vaccination at the Reggie Lewis Center. In particular, we had folks from and correct me if I'm wrong, Samantha, we had folks from Mass General Brigham who were overseeing for medical oversight. We had folks from, Samantha, was it Transformative or Cataldo at Transformative Healthcare, who is an ambulance company, and they were doing, overseeing the actually vaccinating and the vaccine support. We had another group that was actually DMSE Sports, which is best known in the area for being one of the main organizers of the Boston Marathon. And they were our sort of on the ground logistics folks, and just with their background and you can imagine in doing an event like the marathon, their background in logistics and event coordination is outstanding. So that's really, CIC Health's role was bringing in those players who we knew had the experience and the skills, the background to fit those different pieces of the puzzle. And then we helped everybody sort of fit them together.
Coming back to Samantha, Joseph, we still have somewhere to go before the job is really finished. We still have racial disparities in vaccination rates. So what's the plan for dealing with that?
Yeah, absolutely. CIC, now that the mass vaccination sites have shut down, has really focused on our mobile program, which we've been doing for the last few months. And so we tend to do 6 to 10 clinics, across Eastern Massachusetts every single day. And the primary focus of those clinics is to create access to people, for whom going to a mass vaccination site was a barrier. So the Vax Express is a really good example of that. We partnered with the MBTA, Keolis, and Blue Cross Blue Shield to bring a vaccine clinic on a commuter rail train to stations, across the state, to really ensure that we were in communities, that needed, that were hardest hit, that really needed the vaccine. We found that in our mobile clinic program, about 41% of the guests are people who identify as having a Hispanic background, which is a lot higher than many of the mass vaccination sites saw. So we're really proud, of being so present in these local communities and really creating that access point.
By the way, you're president, but what about people from the community who act as leaders, encouraging people to get vaccinated? Was that part of the equation too?
Yeah, absolutely. So we work specifically with community-based organizations. So in Bristol County, the Coalition for Social Justice is our on-the-ground community partner. They have a decades-long track record of working in that community and supporting people there. And so, our outreach team, they're not talking to people they don't know. They're really talking to people who they've had, almost a lifelong relationship with. And that is so critical. We know so much of vaccine equity is about being asked to take the vaccine by somebody you trust, right? Somebody who has credibility to you personally. And so we've really incorporated that into our outreach efforts.
Bring that to Sue. Right now we've heard so many positive messages about so much success, but don't you have to worry that that might slow us down as far as getting more people vaccinated and dealing with variants?
Yeah, I think we're at that point now, and it's the reason that the state has sort of shifted its focus from mass vaccination sites to more targeted community vaccination. Because we are at that point where the folks who from the get-go wanted to get vaccinated have been vaccinated. We are now dealing with populations where there are barriers, whether those are barriers that are related to racial and cultural background and a history with the medical profession that may not have been terribly favorable over the years, whether those are issues of people who are working hourly wage jobs where they need to be working as many hours as possible, as much as they can, and they're nervous about taking time off, not only to get the vaccination, but if they happen to have a day or two after where they're not feeling well and they might need to take off from work, that can be a real barrier. So as Samantha was saying, a lot of the way that we are trying to bridge those gaps is to bring the vaccine and meet people where they are. And not only where they are, but from their community. So it's not like a group of us running in from CIC Health going, hey, you guys should totally get vaccinated. That it is those trusted community leaders, faith leaders, community-based organizations that are going out there and talking to the community and saying, no, you actually can trust CIC Health. They're good folks. And you should get vaccinated for yourself, for your family, and for your community as a whole.
Samantha, what about the need for more people to get vaccinated? Because we hear the reports about the variants. Maybe they're certainly less of a threat for people who have been vaccinated already, but for, there's still a lot of other people out there, isn't there?
Yeah, absolutely. We actually did hear in the last week or so, we've heard more expressive concern over variants. People who had waited to get vaccinated, said that they finally decided to come in because of that concern. And so we're glad that people are, really understanding the risk of not being vaccinated at this point and taking action. I think all we can do is really present, the tools to provide the vaccine, to give the information, to be that trusted partner, and to also, really meet people where they are. And the hope is that they'll come just a little bit to meet us there too.
So a few months ago, when things were getting started here in vaccinations, a lot of us were put off by all that overload in the booking process of vaccinations. I'm sure that's not nearly as much of a problem now. So if there are people out there who still want to get vaccinated and they want to know how easy it is maybe to set up a way to do it, what's your best advice for them?
I mean, honestly, right now at all of the sites that, and not only ours, but everything that the state is doing, walk-ins are welcome everywhere. You do not need to have an appointment. We're always stressing that message, as well as the fact that it's free, that you don't need ID, that you don't need health insurance. Those are really important factors for a lot of folks. And for others who need to actually schedule, we do still offer a way for them to submit their interest, and we'll reach out to them directly and figure out a time that works for them and bring them in. It's a much simpler system. We're actually at this point not really doing a lot of pre-registration in terms of the actual software platform that people have to go through. Even if people say, hey, I want to come in on Tuesday at noon, we say, great, come on in. And we will register them right on site, walk them through, so they don't even have to deal with that platform, that interface at all.
Well, I'd like to thank you both for taking the time to be with us.
Thank you, our pleasure.
Yeah. That was Sue Minichiello and Samantha Joseph from CIC Health. We'll have more news in just a moment.